and we begin the section on genetic disorders. This is a happy face. What do you think we're looking at over here? This is actually an umbilical cord. This is an umbilical artery, and this is an umbilical vein. This is not so happy a face. This is also a cross-section through the umbilical cord, umbilical artery, umbilical vein is the biggest one, of course, and that's not a happy face. All right, indications for genetic counseling. A 37-year-old, gravida 5, para 0, AB 4, comes for prenatal care at 7 weeks gestation. Now, gravida 5 means that she's in her 5th pregnancy. Para 0 means that none of these pregnancies have gone past 20 weeks, and AB 4 means that she has lost 4 of these prior to 20 weeks. She's had a very poor reproductive history. 4 previous spontaneous first trimester abortions. She is concerned regarding the likelihood of her next pregnancy being successful. Now, what are her risks here? Number 1, she is called advanced maternal age. She's over age 35. So that's going to be 1 indication for genetic counseling. And 2 is she's got a poor reproductive history with many spontaneous first trimester losses. When we look at the risk of chromosomal anomalies by maternal age, and remember, the most common reason for first trimester losses is chromosomal anomalies, notice the age and the total risk. At age 20, Down syndrome risk is 1 in 1,500. Total risk of aneuploidy is 1 in 500. Notice what happens with advancing maternal age. The risk of Down syndrome, which is the most common aneuploidy at term, and the total risk goes up significantly. At age 49, 1 in 12 will be Down syndrome, and 1 in 7 is the total risk of aneuploidy. Is that high? Now, if you went to Las Vegas and the likelihood of you winning was 11 out of 12, you'd say that's a pretty good risk. So it's kind of like looking at the glass, is it half empty or is it half full? But still, a risk of 1 in 12 and 1 in 7 is markedly increased over what it is at age 20. And this brings out the important fact that the lowest risk of maternal mortality, of chromosomal anomalies, of reproductive losses, of perinatal mortality is age 18 to 24. The ideal age for childbearing, biologically, not necessarily mentally, not necessarily emotionally, not necessarily socially, is age 18 to 24. At age 35, the risk of total aneuploidy is about 1 in 200, which is about the risk of pregnancy loss with amniocentesis. And so we say age 35 or greater, we offer amniocentesis to women. The most common cause of aneuploidy with advancing maternal age is non-disjunction. And this shows what happens with non-disjunction. The primary gonadocyte gets rid of 1 of each pair of chromosomes, and they are lost in the polar body, which leaves the oocyte with 23 chromosomes. Along comes the sperm, and it has 23 chromosomes. Those two together result in 46 chromosomes, and we have a diploidy. You and I, hopefully, are diploidy, normal chromosomes. If you have loss of the polar body chromosome, it stays with the oocyte, and then you've got the fertilization which occurs. Now you have an extra chromosome, and that is your trisomy. This is increased with advancing maternal age, and we call this non-disjunction. When we look at the indications for genetic counseling, there are numerous, and these are in your notes: a previous child with malformations, a previous child with aneuploidy, pregnancy or fetal losses, positive family history of diseases passed from parents to children, a variety of different things, but clearly the most common one is advanced maternal age. And we're seeing more and more women who are deferring childbearing because of career concerns. Now, here's a couple who came to see me, and when I first saw them, I thought that this was her father. In fact, He is the FOB, which is father of the baby, and she is the mother of the baby. Advanced paternal age. Now, advanced maternal age is associated with increased risk of non-disjunction. Advanced paternal age is associated with increased risk of new mutations. This is unbelievable. A woman aged 63, a California resident, gave birth at 63 years of age. She spent $50,000 on IVF treatments, and she lied about her age when she went in. But can you imagine age 63?